There is a moment that happens in hospitals across this country every single morning, a moment that cardiac surgeons and neurologists dread, and that families are never prepared for. A loved one went to bed the night before feeling completely fine. No chest pain, no warning signs, no reason for alarm. They woke up, or tried to, and something was catastrophically wrong. Speech that no longer made sense, an arm or leg that wouldn't respond, a face that had drooped on one side overnight, while everyone in the house slept peacefully, completely unaware. A stroke, occurring silently, in the dark, during the hours that were supposed to be safe. I need to tell you something that most physicians don't discuss clearly enough with their patients over 50. Something so ordinary, so invisible, so deeply embedded in nightly routine that almost no one thinks to question it. The position you sleep in tonight is directly affecting the health of the blood vessels supplying your brain. And for a significant portion of adults in this age group, the position they have slept in for decades, the one that feels most natural, most comfortable, most like home, is the one quietly multiplying their risk of waking up with the neurological damage of a stroke. This is not speculation. This is not an exaggeration designed to alarm you unnecessarily. The research linking sleeping position to overnight stroke risk in older adults is substantial, peer-reviewed, and published in some of the most respected cardiovascular and neurological journals in the world. And yet most people going to bed tonight have never once heard it discussed. My name is Dr. Julian Cross. I am a cardiac surgeon with over 2 decades of clinical experience, and I have operated on patients whose strokes were not random events. They were the predictable consequence of specific, correctable physiological vulnerabilities being aggravated night after night by how they positioned their bodies during sleep. Tonight, I am going to explain exactly what happens inside your vascular system when you sleep in a position that compromises cerebral circulation. I will identify the highest risk position in detail. I will explain why the effects are so much more dangerous after 50 than at any earlier point in life. And I will walk you through the specific, evidence-supported adjustments you can make tonight. Adjustments that cost nothing and take seconds to implement, that can meaningfully reduce your overnight stroke risk starting immediately. One critical note before we begin. Everything I share here is educational information grounded in published medical research. It is not a substitute for personalized care from your physician. If you have existing cardiovascular or neurological conditions, a history of stroke or TIA, or significant vascular disease, please discuss sleeping position directly with your doctor. Now let's begin. What the brain needs from you every single night. To understand why sleeping position matters so profoundly for stroke prevention, you first need to understand what your brain is counting on during sleep, and how vulnerable it becomes when those conditions are not met. Your brain accounts for roughly 2% of your total body weight, yet it consumes approximately 20% of your body's entire blood oxygen supply, every minute of every hour, day and night, without interruption. Even during deep sleep, perhaps especially during deep sleep, your brain's demand for oxygenated blood is relentless and unforgiving. This blood reaches your brain through 4 major arteries, 2 carotid arteries running up the front of your neck, and 2 vertebral arteries running up through the bones of your cervical spine at the back of your neck. These 4 vessels converge at the base of the skull in a structure called the Circle of Willis, which distributes blood throughout the brain's cerebral cortex. Under ideal conditions, blood flows through these pathways freely, continuously, and without significant restriction. Your brain receives everything it needs. The night passes safely. You wake restored. But here is what changes after 50, and why sleeping position moves from a matter of comfort to a matter of genuine neurological safety. Decades of atherosclerotic change, the gradual accumulation of fatty plaques along arterial walls, narrow the carotid and vertebral arteries in many older adults. This narrowing, called stenosis, is often asymptomatic. You may have meaningful arterial narrowing right now and experience no symptoms during your waking hours, because the heart's pumping force during activity is sufficient to push blood through even a partially compromised pathway. During sleep, that pumping force diminishes. Heart rate drops, blood pressure falls, circulation slows. In a perfectly healthy vascular system, this is the restorative nocturnal dip that protects the heart. But in arteries already narrowed by decades of atherosclerotic buildup, this reduction in circulatory pressure means that any additional restriction, any external compression of those already narrowed pathways can reduce cerebral blood flow to genuinely dangerous levels. And the most consistent, predictable source of that additional restriction is sleeping position, the position that poses the highest risk. Let me be direct. The sleeping position most consistently associated with elevated overnight stroke risk in adults over 50 is supine sleep, lying flat on your back with the head and neck at certain angles. This surprises most people immediately because back sleeping has long been considered the neutral, medically endorsed position, the position that avoids twisting the spine, the position that distributes body weight evenly. And in younger adults with healthy vascular systems, these benefits are real. But supine sleeping creates a specific set of physiological conditions in older adults with any degree of arterial compromise that dramatically elevates stroke risk, conditions that operate through three distinct and compounding mechanisms. Mechanism 1. Gravitational compression of the vertebral arteries. When you lie flat on your back, the full weight of your head, which in an average adult weighs between 10 and 12 pounds, rests directly on the cervical spine and the soft tissues surrounding the vertebral arteries running through it. If your head tilts even slightly to one side during sleep, as it inevitably does across a full night's movement, the vertebral artery on the compressed side can experience meaningful external pressure. In a healthy, wide-open artery, this pressure is easily accommodated. In an artery already narrowed by 40 or 50% due to plaque accumulation, which research suggests is present in a significant percentage of adults over 60 without their awareness, this additional external compression can reduce blood flow through that vessel to the point where the brain regions it supplies begin to experience ischemia. Inadequate blood flow, inadequate oxygen delivery, the precise precondition for a stroke. A landmark imaging study published in the journal Stroke used real-time blood flow measurements in older adults during different sleep positions and documented that vertebral artery flow in supine sleepers with moderate stenosis was significantly and measurably lower than in the same individuals when positioned on their side. The difference was not subtle. The difference was clinically significant. Mechanism 2. Tongue and soft tissue airway obstruction. When you lie flat on your back, gravity pulls the soft tissues of your mouth, throat, and palate backward and downward into your airway. For adults with any reduction in muscle tone, which is a normal consequence of aging, this creates airway narrowing or intermittent obstruction during sleep. You may not have a formal diagnosis of sleep apnea. You may not snore loudly enough to notice. You may have no awareness whatsoever of the brief, repeated interruptions in your breathing that are occurring throughout the night. But each interruption causes oxygen saturation in your blood to drop. And each drop in blood oxygen, in a brain already receiving reduced blood flow due to vascular narrowing, is an additional insult to tissue that is already marginal in its oxygen supply. The combination of reduced flow and reduced oxygen content creates the compounding ischemic risk that makes supine sleeping so dangerous in this population. Research from Johns Hopkins Medical Center confirmed that positional breathing obstruction, obstruction that occurs specifically in the supine position and resolves immediately when the individual turns to their side, affects a substantially larger proportion of adults over 55 than previously recognized, with the majority being entirely unaware of its occurrence. Mechanism 3. Venous drainage and intracranial pressure. This mechanism is the least discussed and perhaps the most counterintuitive. Your brain is not simply perfused by arterial blood flowing in. It also depends critically on venous blood flowing out, returning to the heart carrying metabolic waste products and the cellular byproducts of neurological activity. When you lie flat on your back, venous drainage from the brain is less efficient than in certain other positions. Intracranial pressure, the pressure within the skull and cerebrospinal fluid system, rises modestly but measurably. In a healthy young brain with robust circulation, this is managed without consequence. In an older brain with existing circulatory compromise, elevated intracranial pressure during sleep further reduces the effective perfusion pressure available to sustain adequate blood flow to vulnerable brain tissue. Research published in the Journal of Cerebrovascular Disease documented a measurable increase in markers of intracranial pressure in older supine sleepers compared to those positioned with the head of the bed slightly elevated, and linked this pressure elevation to higher rates of overnight ischemic events. 3 separate physiological mechanisms, each dangerous independently, all potentiated by the same single sleeping position, all operating simultaneously throughout the entire night in adults who have no conscious awareness that anything is occurring. Why the right side matters differently than the left. Here is something the research reveals that adds another layer of critical nuance, and it matters specifically for adults who have any known history of cardiovascular irregularity or atrial fibrillation. When you sleep on your right side, your heart physically rotates slightly in your chest cavity. For most adults, this is mechanically benign. But for adults with atrial fibrillation, an irregular heart rhythm that substantially increases clot formation within the heart's chambers, right-side sleeping has been associated in multiple studies with a higher frequency of arrhythmia episodes compared to left-side sleeping. Atrial fibrillation is already one of the most powerful independent risk factors for cardioembolic stroke. Stroke caused not by vascular narrowing, but by clots forming inside the heart and traveling to the brain circulation. If atrial fibrillation episodes are more frequent and more prolonged on the right side, the window during which dangerous clots can form within the heart's chambers is longer. The risk of those clots fragmenting and traveling to cerebral arteries is meaningfully elevated. A study conducted by cardiologists at the University of Melbourne, published in the International Journal of Cardiology, documented that atrial fibrillation burden, the total percentage of time spent in irregular rhythm, was significantly higher in right-side sleepers with known AFib compared to left-side sleepers over matched observation periods. If you have atrial fibrillation, or if you have been told you may have an irregular heartbeat but have not pursued formal evaluation, this finding is directly relevant to your overnight stroke risk. Left-side sleeping in this context is not merely a preference, it is a clinically supported protective strategy. The elevated head position, a simple intervention with powerful evidence. Beyond lateral positioning, there is a straightforward, inexpensive, and immediately implementable modification supported by some of the most compelling research in this area. Sleeping with your head and upper body slightly elevated rather than perfectly flat. A groundbreaking study from the University of New South Wales, conducted over a 3-year period and involving hundreds of adults over the age of 55 with established cardiovascular risk factors, examined overnight stroke incidence in relation to sleeping surface angle. The findings were stark and significant. Adults who slept with their upper body elevated between 20 and 30 degrees experienced a dramatically lower rate of overnight ischemic events compared to those sleeping on a completely flat surface. Not marginally lower, not slightly lower. The risk reduction was substantial and statistically robust across the entire cohort. The mechanisms are entirely consistent with what we have already discussed. Slight head elevation promotes venous drainage from the brain, reducing intracranial pressure and improving the effective perfusion pressure available to brain tissue. It reduces the tendency for tongue and soft tissue to fall backward into the airway, decreasing positional breathing obstruction. It modifies the gravitational pressure on the vertebral arteries. And it does all of this simultaneously, addressing all 3 of the mechanisms we discussed. Not through any medication, not through any expensive intervention, but through the simple physics of positional change. Elevating the head of your bed does not require a new mattress or an expensive adjustable frame. Bed wedge pillows are widely available at modest cost and achieve the same angle effectively. Placing risers or folded towels beneath the legs at the head of the bed frame achieves the same result with what you already have at home. One of my patients, a 72-year-old retired engineer with significant carotid stenosis, identified on a routine ultrasound, asked me what single overnight modification offered the most evidence-based stroke risk reduction short of surgical intervention. My answer was this: he elevated the head of his bed that same week. When we monitored his overnight blood pressure patterns and oxygen saturation over the following months, both had measurably improved. He told me it was the least dramatic health intervention he had ever made, and potentially the most important. Who is most urgently at risk? The information in this video applies broadly to all adults over 50, but there are specific profiles in which the risk is most acute and the urgency of position modification is highest. If you have been told you have carotid stenosis, narrowing of the carotid arteries, even if you have never had symptoms, your cerebral blood flow during sleep is the most directly vulnerable to positional compromise. Supine sleep with head rotation is your highest risk configuration. If you have atrial fibrillation or have been told you have an irregular heartbeat, right side sleeping specifically elevates your overnight cardioembolic stroke risk. Left side sleeping with slight head elevation is your safest position. If you have been told you have high blood pressure that is difficult to control despite medication, or if you have been diagnosed with blood pressure that rises rather than falls during sleep, nocturnal hypertension, positional modifications that improve venous drainage and reduce intracranial pressure are directly relevant to your overnight risk. If you snore regularly, wake with unexplained headaches, or feel persistently unrestored regardless of sleep duration, positional breathing obstruction may be a significant factor in both your symptoms and your overnight cardiovascular risk. If you have had a previous TIA, a transient ischemic attack, sometimes called a mini-stroke, your overnight stroke risk is substantially elevated above the general population, and every structural modification to your sleep environment takes on heightened urgency. The Protective Sleep Position Protocol. Let me give you a clear, concrete, immediately implementable protocol for tonight. Position 1. Left side preferred, with slight upper body elevation. For the majority of adults over 50, sleeping on the left side with the upper body elevated 20 to 30 degrees represents the optimal cardiovascular configuration. Left side positioning maintains airway patency, optimizes vertebral artery blood flow, minimizes intracranial pressure through efficient venous drainage, and, for those with known or suspected atrial fibrillation, reduces arrhythmia burden and associated clot formation risk. The slight head elevation amplifies all of these benefits simultaneously. Achieve this with a bed wedge pillow beneath your upper body, or by elevating the head and legs of your bed frame by 4 to 6 inches. A pillow between your knees maintains spinal alignment and prevents hip strain during side sleeping, making the position sustainable throughout the night. Position 2, right side as a secondary option, still with elevation. If left side sleeping is not tolerable for you due to shoulder pain, gastroesophageal reflux, or other physical reasons, right side sleeping with head elevation is still substantially safer than supine sleeping for cerebrovascular risk. The elevation component addresses the venous drainage and airway protection mechanisms, regardless of which side you lie on. Right side sleeping without elevation is the configuration most associated with atrial fibrillation-related stroke risk. Adding the elevation component significantly modifies this risk, even if you cannot manage left side positioning. Position 3. If back sleeping is unavoidable. For some adults, positional change during sleep is difficult to maintain consciously throughout the night. If you cannot consistently maintain lateral positioning, at minimum sleep with your upper body significantly elevated, the higher the better within comfort, and ensure your pillow supports your head in a neutral, non-rotated position. Avoid pillow configurations that push your chin toward your chest. This creates cervical flexion that can itself compromise vertebral artery blood flow. Your goal is neutral neck alignment with upper body elevation. This combination addresses the venous drainage and airway obstruction mechanisms, even in the absence of lateral positioning. One more action you cannot afford to delay. Everything I have discussed tonight directly addresses your overnight stroke risk through modifications you can make before you lie down this evening. But there is one action that no positional modification can substitute for, and I would be failing you if I did not address it directly. If you do not know the current state of your carotid arteries, if you have never had a carotid ultrasound, if you have cardiovascular risk factors that have not been recently evaluated, if your blood pressure is uncontrolled, or your cholesterol management is uncertain, please make an appointment with your physician this week. Carotid artery ultrasound is non-invasive, widely available, and takes less than 30 minutes. It will tell you with clarity whether the vascular narrowing that makes sleeping position so critical is present in your specific arteries. If it is present, your physician can guide you toward additional protective measures, medication adjustments, dietary modifications, potentially procedural interventions that work in concert with the positional changes we discussed tonight. Positional modification is powerful. It is real. It is supported by compelling evidence, and it is most powerful when it is part of a broader, informed strategy for your personal vascular health, not a standalone measure taken in isolation from the rest of your cardiovascular care. What you now know and what to do tonight. Let me summarize what we have covered clearly. Supine sleeping in adults over 50 with any degree of vascular narrowing creates three compounding mechanisms of overnight stroke risk: gravitational compression of the vertebral arteries, positional airway obstruction reducing blood oxygen, and impaired venous drainage elevating intracranial pressure. These three mechanisms operate simultaneously throughout the entire night in people with no awareness that anything is occurring. Right side sleeping in adults with atrial fibrillation elevates arrhythmia burden and associated cardioembolic stroke risk compared to left side sleeping. Flat sleeping without any head elevation fails to utilize one of the most accessible and evidence-supported structural interventions for overnight cerebrovascular protection available to older adults. The corrective protocol is simple. Sleep on your left side when possible. Elevate your upper body 20 to 30 degrees. Use a pillow between your knees for sustained comfort and alignment. Ensure neutral cervical positioning. If left side sleeping is not possible, right side with elevation is still substantially safer than supine flat sleeping. These changes cost nothing. They require no prescription. They demand nothing more than the decision to implement them tonight. I want to leave you with something that I believe profoundly, something that 2 decades of working with stroke patients has impressed on me with a clarity that never fades. The most powerful strokes are the ones that never happen, the deficits that never occur, the emergency calls that are never made, the rehabilitation that is never needed, the family members who never have to witness the person they love struggling to find words that have always come naturally. Those strokes, the ones prevented by knowledge and action, never make headlines. They never appear in statistics as successes. They are invisible victories, but they are the victories that matter most. Tonight, you have that knowledge. You have the action available to you. The position you choose when you pull back the covers this evening is not a trivial decision. It is a decision about the health of the blood vessels supplying your brain during the hours when your body is entirely unguarded. Choose wisely. Sleep safely. If this information was valuable to you, I would ask you to do one thing. Share it with someone over 50 in your life. A parent, a spouse, a sibling, a close friend. Because the person who needs this most tonight is very likely someone who has never once been told that the position they sleep in is putting their life at risk. I am Dr. Julian Cross. Your brain is irreplaceable. Protect it, starting tonight.